fusion at L4 and 5. Slowly deteriorated. I didn't have an accident, but it was quite severe. Over time, it really got bad. I couldn't go anywhere. I had to lay down all the time. So I was really limited on when I could go out, and I had to get home right away and get back in bed. That's how bad it got. It was where I was in bed 95% of my day. You know, I had a bad attitude and short-tempered, you know, didn't want to deal with nobody or nothing. There was nothing I could do to relieve the pressure, you know, to take care of the problem. And it just progressed over time. Over a 2-year period, it got worse and worse and worse and worse, you know. And from having the previous one, I knew something was wrong, you know, but I didn't want to go through that again, you know. So I was hoping it would go away, you know, but obviously it did. I was taking Motrin, Tylenol, lidocaine patches on my back all over the place, and it wasn't trying to relieve the pressure, and it just wasn't doing it. And I would go to sleep for 3-4 days, no sleep. It was tough, you know, and there was nothing I could do to get rid of it. Couldn't socialize, didn't want to, you know. I was like, just get me home, you know. I couldn't lay down. Finally, I said, I got to get help. I knew something was wrong. I made my first appointment with Dr. Bono through my doctor. My doctor told me don't let anybody but him work on you. And that's what led me to him. Everybody knows him all over the place. When I had the MRI done at a different building, they're like, who's doing it? And I said, Dr. Bono. They said, that's who you got to get. So he's like got a good name out there. So I was sure I could trust him. And then when I met him, the kind of way he runs himself, he's pretty easygoing, but he's straightforward.
My first interaction with Dennis was in my office, and at that point I realized that I had in front of me a man who really had a lot to live for, a guy who really wanted to be part of society, function in society, be able and capable. And I found that he was quite frustrated with the fact that he couldn't get around, walk, do the things that he wanted to do. So he had pretty much been through everything. He went through anti-inflammatory medications, he took some narcotic medications to help with the pain, he went through physical therapy in which they did ultrasound treatments, electrical stimulation, muscle treatments to alleviate the tension in his muscles in the back, the buttocks and the legs. They strengthened his muscles, they stretched his muscles, they stabilized his core, and none of that really made much of an impact on the symptoms. I just felt that at this point, he wasn't able to walk very far. He wasn't able to keep up with his friends and his spouse, so he just was limited to a sit-down life, a sedentary life. So some people don't like to resign themselves to that quality of life, and he was not ready to sit in front of a TV the rest of his life with a remote control in a limited fashion. So for that reason, I offered him the surgery.
Surgery went great. My first time with my first fusion, it was an 8-hour surgery. He done it under 2 hours. About 5 hours later, not even, you know, they come in and ask me, how's your right side? I'm like, you know, I don't have any pain in it at all. You know, and it wasn't because of the medication, it was because of what they done. Everything was coordinated great. And, you know, the treatment I got was off the wall. I couldn't believe how they were spot on with everything. I was very impressed. I did not think it would be like that.
The procedure went smoothly. It took about an hour and 10 minutes to perform the surgery. His recovery was uneventful. He was back to driving the car on the 3rd week. He was off of his narcotics very quickly. If you bumped into him 2 weeks after the surgery, you'd never know he had a major spinal fusion.
The second day I was walking. I'm still recovering because it's under 2 months, but I'm a lot happier now. You know, I feel a lot better emotionally, mentally, and no pain on that side, you know what I mean, what I was suffering through. That's gone, so that's a big relief. You know, now I'm just dealing with the recovery end of it. Dr. Bono did an excellent job. I can't believe how good it came out. And when I come back and seen Dr. Bono, he was almost clapping. He was smiling from ear to ear when he seen me walk in there like that, you know. well, he's how you doing? I'm like, great, you know. So it made me feel good to see him smile like that. He's a good guy.
The satisfaction for me is really giving people their lives back and relieving pain. Pain, nerve pain particularly, is a very difficult type of pain to relieve. Painkillers don't get rid of it. We have a drug called Neurontin, which is a nerve pain stabilizer. That doesn't get rid of it. And it's just a hard pain for patients to cope with, because the only way they can get rid of it is just by diminishing their activities and sitting down. So the restraints on lifestyle for these patients is really disheartening, and it really gives me a lot of satisfaction, gratification, and pleasure to be able to restore functionality to people's lives and give them the happiness that I have in my life to be able to go out and enjoy the things they want to do.